So why is there no respect for doctors in the UK? Let's talk about it. I mean, when I was a medical student, I was looking forward to becoming a doctor because watching other doctors and patients, watching the way, doctors solve the patient problems, watching the way the patient look up to the doctors to solve the problems, this was a fantastic doctor-patient relationship that I was looking forward to. And I was like, I cannot wait to establish this for myself. But in this present time, what you've noticed is like a tug of war, is like a battlefield out there between the doctors and the patients. You've got the doctors on one side, and then you've got the patients on the other side. Now, in the UK, I don't know how it is in other countries, there's this perception that there's a hierarchy of doctors. So you've got the specialists who are in the hospitals and in their clinics, like your cardiologist, your neurologist, your hematologist, and then you've got your family doctor, otherwise known as a practitioner, your general practitioner. So your family doctor is usually the one that does the referral to the specialist if you're under the NHS. So a patient will come to the doctor, doctor, I've got this problem. So it could be a knee pain, for instance. I've got a knee pain, I want a referral to a specialist. Whereas the doctor might say, oh, why don't you take some painkillers? Why don't you try some knee exercises first? Come back in 6 weeks and see how you go. And the patient will be like, but I don't want to come back in 6 weeks because I need this problem solved now. And if you refer me in 6 weeks, it could be another 12 to 18 months before I see a specialist, because currently in the NHS, there is a very long waiting list to see a specialist. So this is what I mean by this tug of war. The patient is like, my doctor doesn't want to refer me, and the doctor is thinking, it's a bit too early to refer you because there's already people on the waiting list and you've not even tried anything yet. So in this regard, GPs are kind of seen as the obstacle, the barrier to being seen by the doctor you actually want to see. So that is one reason why general practitioners bear the brunt, they're the front line, and they bear most of the brunt of disrespect from patients and from the public in general. Now, me personally, I used to think that, patients will come to you and say, oh, hello, doctor. How are you doing, doctor? How is your family? I don't get any of that at all. All I get is, hello, mate. I think I've got a chest infection and I need some antibiotics. And I've been a while now. I've been in this business or field for a while now. Okay, so I've got teenagers that I see. And can you imagine a teenager coming to me, which actually did happen, an 18-year-old boy came to me and said, mate. I'm like, I'm not your mate. I'm your doctor. We're not mates. We don't go to the pub together and have a drink. We don't kick football together. We don't have a chat on the phone. I've only just met you for 2 minutes and you're calling me mate. I am not your mate. How can an 18-year-old come in and call me mate? What about hello, doctor? Not even call me by my name. It's mate. So, and this is just an example. There is a lot of this going on with hello, mate. How you doing, mate? And when I speak to my female colleagues, it's the same thing as well. Like a lot of the female colleagues have told me that patients don't even call them doctors. Patients call them nurse. Can you imagine? You're seeing the doctor tells you to come in and you're calling the female doctor nurse. I mean, what silliness is that? And some of my female colleagues have said that some patients they don't take it as a compliment. Some patients have said to them, oh, have you just come out of medical school? Have you just finished medical school? You look a bit young to be a doctor. For some people, that might be a compliment, but for someone who's experienced, it kind of puts them a bit low because they're seen as maybe they haven't got enough knowledge. They haven't got that much knowledge to treat the patient. So from the doctor's perspective, saying that will not be a compliment in that kind of work environment, if you understand what I'm saying. Now, I cannot imagine the same people who call me mate saying that to a specialist. You would not say to a cardiologist or a neurologist, hello, mate. I've never heard of that happen. It's going to be hello, doctor, hello, surgeon, hello, mister, whatever the titles are, not hello, mate. So this is what I mean by why is there no respect for doctors in the UK anymore? Also, you can see the way the media has portrayed doctors, especially during the COVID pandemic, as doctors just sitting in their room doing nothing while making lots of money. Doctors don't want to see patients, there's telephone, you cannot see a doctor when you want to. A lot has changed. Look, I understand. I know there are some doctors who are lazy, as you would in any other profession. There are some doctors who are lazy who just don't want to see patients. But what about the hardworking doctors? You never hear the media talk about the hardworking doctors, those ones who are selfless, who see more than the patients they need to see on their list, those ones who still go on home visits, even when they don't need to. So after seeing the patients on the list, They forget about lunch and they're heading straight for home visits, which might be 2 or 3 home visits, no lunch, and then back to work again, just in time for the afternoon to start their afternoon session. And then after the afternoon session, another home visit or 2, to see the patients who cannot leave the house and who want to be seen. I personally know some of these doctors, but no one mentions these doctors. All they want to mention is a negative bit. The negative side of, oh, these doctors do not want to see any patients. They're doing nothing. They're making lots of money. Please show me the money, because I ain't seen that sort of money these doctors are making. So it's like the media has planted this seed in the mind of patients that doctors are doing nothing. So a lot of the patients are now aggrieved and they're thinking, this doctor doesn't want to see me. I'm trying to see a doctor. But what's happened is a lot of doctors have actually retired. We're short of doctors in NHS because no one's really going into medicine anymore. People are disillusioned, lack of pay, the degree is too long, or for whatever reason, we haven't got much people going to the profession. Doctors are retiring at a faster rate than you can replace them. And also because of the working conditions in NHS, most doctors do not want to become permanent in the surgery. So they would rather locum or become self-employed. And this is the issues that we're facing in the NHS. Then you've got the expectations of patients as well. You've got TV shows like Your House, Grey's Anatomy, ER, Holby City, all these medical shows where basically the perception is that patients can get their problem solved straight away. You come to see the doctor and within 5 minutes, the doctor knows what's going on. And you can see this happening in real life where patients are coming in and saying, look, I want this sorted out. There are some problems that might take weeks or months to sort out. Some patients expect them to get solved that same day. Some patients expect a referral that same day. And realistically, as a doctor, that's not going to happen because in the NHS, there are several hurdles, several pathways that you have to go through. So for example, if you want a referral to see what you call a colorectal surgeon, the colorectal surgeon might say, before you do a referral, I want some blood tests. I want to check that patient's inflammatory markers. I want a stool test, to check for any inflammation or any signs of cancer. And some of these tests can take days or weeks to arrive. A stool test might take 2 weeks, so that could be another 2 weeks of waiting. And if that stool test is normal, once you get referred, that could be another 6 to 12 week wait for a colonoscopy. And this is the frustrations that we have in NHS. And a lot of patients think this is the fault of the general practitioner. This is not the fault of the general practitioner. This is just the way the NHS is being run at present. The waiting list on the NHS has got nothing to do whatsoever with the GP. The GP is not responsible for the long waiting list in the NHS. And then another factor why you would say doctors not having a respect is basically a lot of patients are feeling that their problems are being fobbed off. They feel like the doctors is not listening. A lot of doctors at present are having what we call pressure of time. A lot of appointments are 10-minute appointments. A lot of patients have complex problems. Some complex problems cannot be solved in 10 minutes. A lot of patients are coming with 2 or 3, problems which cannot be solved in 10 minutes. And as you know, it is hard to get appointments. And the patient feels that if I don't tell my doctor this problem now, I'm not going to get a chance. It could be another 3 or 4 weeks before I see the doctor again. So you can understand that from the patient's perspective, why they need to tell all these problems now. The doctor's perspective as well, under pressure, running late, another 10 or 12 patients to see, and then it becomes that domino effect where the doctor is running late and all patients are now starting to get angry, saying, look, you're meant to see me at 12 o'clock, now it's 12:30, now I have to go and pay extra for my car parking ticket. So this is the problem that we're having. And then the doctor starts getting abused, saying, as soon as the doctor starts the consultation, the doctor starts getting abused. And then the report is gone, because once you start getting abuse once you start giving the doctor abuse, the report is gone, because now the doctor has to go on defensive. The doctor might be stressed. Now the doctor gets angry, and then you lose that rapport, you lose that, that feel that you would have had, that relationship that you would have had with the doctor. And then there becomes a lack of respect there. And also some patients, like I said earlier, oh, doctor, I've got a chest infection and I want antibiotics. Where is the history? A lot of doctors, they're very systematic in their approach to patients. They want you to tell them the story, the history of how it happened. You tell them the history, the timeline. They don't want to do the examination. And then after the examination, they might want to run some tests, or depending on what the problem is, then they might say, look, this is what you need to have, or this is what you do not need to have. But a lot of patients are now self-diagnosing thanks to Dr. Google. They now think, this is what I've got. And some patients are right, some patients are wrong. However, showing respect is letting the doctor do his job first. And if you feel the doctor is not doing his job, then you can now step in and say, doctor, this is what I think is going on with me because I know my body quite well. However, a lot of patients come with that approach as, I already know what's going on. I don't want to go through the history. Just give me what I need. And you can find that some doctors feel, because doctors want to feel like they're doing something to help. And doctors are trained to go through this process of going through things systematically. And as a patient, you have to respect that as well. You know, if you respect the doctor, trust me, the doctor will go more than an inch for you. Believe me, you know, I have had patients who are so lovely that I have gone above and beyond what I should have done for them, in the sense that I'm not asking them, look, do you have any other problems you want to solve today? And then I've had patients come in and disrespect me to the point where I'm like, look, sorry, we cannot continue this consultation because now you're disrespecting me, okay? And I'm not gonna just sit here and take it. I'm from the streets too, you know, I can bring it on too. I'm from the streets, but you know, I keep that street side of me suppressed, you know, doctor mode, you know, the different facets of me, in case you didn't know. I've got the doctor mode, I've got the street mode as well, but I suppress that street mode very, very well. I've been in the streets, you know, not as a bad person or anything, but you know, I am knowledgeable in certain aspects of life. I can hang out with anyone, with anybody. I can mix with anyone. I can mix with the upper class, I can mix with the social class, middle class, lower class, I can mix with all sorts. I'm versatile. And one of the things that patients get frustrated about quite a lot is that a lot of doctors now do not speak English. And whose fault is that? It's not my fault, you know, but the NHS is desperate, you know. There is a shortfall of doctors, like I said. There is a hole that needs to be plugged in. So the NHS desperately recruits a lot of these doctors without giving them the time for proper training in terms of, you know, the etiquette, in terms of, you know, learning to speak English. You know, they just want to fill the gap so quickly. And a lot of patients get frustrated because they're seeing doctors who do not even barely speak English. If the doctor cannot speak English, how can the doctor help you with your problem? And that's what can be very frustrating for a lot of patients. Now, on the flip side, you know, I can understand why some patients feel that the doctors are just making money. They're not really interested in seeing patients. Sometimes you're looking from the outside. If you go to the front of the surgery, for instance, you might see, you know, the plush car, you know, this doctor's driving a Range Rover or this doctor is driving a Porsche, and they're not seeing anyone. So again, that perception has already been built that, okay, these doctors are rich, they're making lots of money, you know, but they don't want to see anyone. And then the media is now feeding that same information, you know, into the minds of the public. And then this is what happens when basically it becomes that tug of war it becomes like a war front, whereas in the past, doctors and patients come together to solve the problem. You now have patients abusing doctors, and then doctors now leaving the profession because they're like, I cannot take this abuse for relatively low pay, because majority of doctors in the UK are actually not paid very well. Believe me, the average salary in the UK is £70,000. Okay, £70,000 is not very much if you compare it to a lawyer who might make £300,000 or a plumber, you know, who might make more than that. Okay, so a salaried doctor earns about £43 an hour. A plumber earns about, depending on the area, anything between £60 to £90 an hour. I know some people have told me plumbers will not work for less than £100 an hour. So imagine a doctor, you know, £43 an hour. Someone in a supermarket would earn about, don't quote me, but probably between £11 to £15 an hour, depending on the seniority of the person. You know, a nurse would earn about £20 an hour on average, about £20. I think I'm correct in saying that. So you can see that the pay is not great. You know, £43 an hour, it's not great. A lawyer earns £200 to £500 an hour. So yeah, there you go. So that is my reasoning for why there is no respect for doctors in the UK. If you have anything extra to add, please drop in some comments below.